The present moment doesn't look like 2013 will be easier than 2012. If we see at some of the developments over the past few days and weeks, we see that a broad range of countries are now in crisis or neighboring crises, from northern Mali to Somalia, from Syria to the neighboring country, from Afghanistan into the Persian Gulf. So I do believe that these are strategic areas and contexts where we will have to focus on. I'm deeply convinced that this must be an important priority next year, to show that the way ICRC is operating in those contexts, is engaging with armed groups, is producing results, and that we can show that this way we are able to attend people. I'm very worried to look at contexts today where instead of being protected, medical workers are attacked, which leads to insecurity of the medical sector as a whole, and leads to the weakening of health systems. So I think we have to stand up against this tendency, and to show that there is no tolerance for the kind of behavior I was describing. We see states reluctant to give access to ICRC. We see states reluctant to treat us as an organization which needs some support also in delivering humanitarian aid in their countries. So we have whole areas which are not open to our activities. I consider security, access, and the credibility of a neutral and impartial action as very important challenges. Well, I'm certainly very much impressed by what the organization does in situations of conflict and difficulties. You know that I have visited Afghanistan, I have visited Syria, Mali, Niger, and in each of those contexts I've been very much impressed by the capacity to deliver, the capacity to reach people who needed help. I have been impressed by the dedication and compassion of all the ICRC staff, and also the Red Cross and Red Crescent staff. I met the volunteers which are interacting with ICRC in many contexts. So I'm deeply impressed by the operational capacity to reach people, to attend to their needs.